The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Hello everyone, and welcome to Health and Wellness. My name is Paul Dreslow, and I'll be your host. Today we're going to be talking about pediatric dentistry and basically caring for children's teeth. Topics such as visiting the dentist, brushing and flossing, and the impact of diet on your children's teeth. So to help us talk about some of these topics, we are very fortunate to have with us today Laurie Vane, who is a dental hygienist with the Pediatric Dental Group of New York. So welcome, Laurie. It's really great to have you here today.
Thank you for having me.
Not a problem. All right, we'll just go over some very general information about pediatric dentistry, and we'll kind of delve into babies and children thereafter. So basically, just to start off, what exactly is a pediatric dentist?
A pediatric dentist is a dentist who specializes in treating children from infancy to the later teen years.
Okay. What is the difference between a pediatric dentist and a general practitioner, one that you might bring your entire family to, no matter whether they're 0 or infants or whether they're 18? What is the difference, and why would you see one versus the other?
I think the best analogy to the difference between a pediatric dentist and a general practice is comparing it to a pediatrician and a general practice doctor. A pediatric dentist specializes in treating children from infancy to the later teen years, and they're equipped to treat these children. Each child's independent needs, for sure. Where a general practice treats like a general population, and they do a multitude of different treatments.
So would you start with the general practitioner, and then if you had some kind of a need to go to pediatric, would you do that way? Or would you start your child right away with the pediatric?
I would start your child with a pediatric dentist. They're equipped to be able to see your children and treat your children, and they have staff that's special trained to work with those children as well. We start to see them as soon as they have eruption. Their teeth are starting to erupt. And the pediatricians actually recommend that you see a pediatric dentist as well. Okay.
All right. So you had mentioned babies and children and their child's teeth, their baby's teeth erupting. When does that actually start to happen?
Generally, teeth start to erupt the first 6 to 8 months of life.
Okay. With your baby or any very young child, how do you go about cleaning their teeth, and what should you use and how often and things like that?
We recommend a product called by Tenders. It's a little finger type of washcloth, if you may. They're washable and they're sanitary, and you just wet it and you kind of wipe the baby's mouth out. You can also use just a regular cloth as long as it's clean. Just wet it and wipe it out until they have teeth, and then they make like infant toothbrushes. We give out little infant toothbrushes as well.
So how do you prevent, or how do you deal with tooth decay that might result from a baby, either nursing or using a bottle or whatever? How do you deal with that in children?
Well, we deal with children that come in from bottle decay. Usually it's due to the fact that they're going to bed with a bottle. So we recommend that they don't go to bed with a bottle, or even as soon as they can be weaned off a sippy cup is the best way to not expose them to having the bacteria and the sugar source mixed together, which is what causes the acid attack on the enamel. If you have to put them to bed, we prefer that you put them to bed with water as opposed to milk or soda or juice, which is usually the case from what we see. And then obviously the doctors recommend treatment. and the treatment can vary depending on the doctor and what they feel needs to be done, the extent of the decay.
Okay, even for babies,
Yes. Yep.
Wow. All right, so with children, or basically with children, what is the difference between the primary teeth and the more permanent teeth that you get as you go on?
The primary teeth are the teeth, their initial set of teeth that are lost, and then their adult teeth come in after, taking the place of where the primary teeth were and more additional teeth.
If you had a decay problem with your primary teeth, knowing that you're going to lose them at some point, does it make sense to like either fill cavities or whatever the issue might be? Does it make
Absolutely,
sense
because the infection from the cavity that the child may have can travel to the adult teeth that are coming in, and we don't want that to happen. So we do the treatment to the primary teeth.
Okay, I wouldn't imagine that, but I'll take your word for it. But, so what how do you actually go about filling cavities on a small child or a baby's tooth? Whether it's with the primary teeth or the more permanent teeth, how do you go about something?
Well,
like
we are equipped to do some treatment at our practice. So we'll use what they call laughing gas or nitrous oxide. We also do oral conscious sedation, which is an oral drink that they do to make some kind of, so they're not going to remember that they're having the treatment. And if the decay is extensive, we sometimes recommend just taking them right into the hospital and right in the operating room and just doing all the treatment that needs to be treated under sedation there.
Oh, in the hospital, you actually bring
right.
The general.
Right. Yeah.
When do you really start or encourage your child to start brushing or flossing either on their own or you're helping him or her, or what age does that usually start at?
Generally, we recommend as soon as the first eruption of teeth. Sometimes it's about 8 teeth to 18 months or so.
Okay.
But we see children sometimes right as soon as teeth are starting to erupt, so depending on the child.
Okay. How often should a child either brush or floss, whether it's per day or per whatever, versus an adult?
We recommend twice a day with the help of a parent, obviously. Children generally can't really do a brush on their own. I think the rule of thumb they say to go by is when they can tie their shoes, they can brush on their own, truly. Between 7 and 8, we usually see them doing it more on their own.
Okay. If the child is resistant, are children typically resistant at all, or is there any good tasting toothpaste or anything?
It's trial and error when it comes to toothpaste taste. Children across the board can be kind of finicky, depending, but it's really truly a trial and error. We have recommendations just to try certain things. I would just try different ones.
Okay. You had mentioned before the fact that the decay comes from food sitting on your teeth, basically, or the sugars that happen as a result of food. What's really the impact of diet on teeth, on oral health? Like, how does that process go from eating to decay?
The cavity process is the plaque bacteria, which is on your teeth, depending on how much is there. Sometimes, if they're not good brushers and they're not removing it properly, it'll sit longer. And then you add a sugar source, soda, juice, extensively, and then that mixes together and it causes an acid attack on the enamel, causing it to break down and eventually causing a cavity.
So if you get rid of the germs that were sitting there, you could
and the sugar
help
source.
out, and the sugar, you have to do both.
Yes.
Okay. What about fluoride? Like adults sometimes use that in their toothpaste, or there's mouthwashes that have it in as well. How does fluoride? What is it, and basically how does it help you or help anyone, a child or an adult, with their teeth?
Fluoride is a naturally occurring substance, healthy in moderation, not in excess. It definitely helps if you do it topically, because then that way it covers the tooth surface. And then if it's ingested, it actually is helpful when the tooth buds are developing. So when the adult teeth come in, they're stronger. So it's definitely recommended. And it's safe and used in moderation.
Okay, yeah, is there any type of, for kids, is it better in toothpaste? Is it better in the mouthwashes? Is both of them too much? Because you see, you mentioned moderation, so I don't know.
Right. I mean, if the child is taking, is ingesting like a tablet that a doctor's, either the pediatrician or the pedodontist is writing for, and they do a topical every 6 months when they come in, that's safe. Okay. I think if they're, it's hard to say exactly how much is too much. Like I said, if you just do it in moderation and you're not doing it in excess, then it's going to be a safe bet. The child will be fine.
Okay. And the moderation, same thing for adults, I'm assuming, pretty much.
Right.
What do you do in cases where a child is afraid to go to a dentist? You had mentioned before about your particular facility. You have pictures of Noah's Ark and stuffed animals, things like that. What do you do in cases where the parent has trouble getting the child there, or when the child's right in the office, you're really having problems with them being scared?
We recommend that the parent bring the child in and get them familiar with the environment. The environment that we have in the office that we're in is very warm and it's comfortable, and they're intrigued with just the visual when they come in, and all the staff is really great. They really do cater to the children and make it fun and make it enjoyable, because we want them to have a really good experience.
I guess that's one of the other differences between the pediatric dentist
Right,
and the regular family dentist. So, what about dental sealants? I've never actually heard of that. So, what are they, and how do they relate to children? Are they specifically related to children, not adults?
Dental sealants can be. We usually do them on children, but I've done them on adults as well.
Okay.
They are specifically for the deep grooves in the tops of your permanent molars and the back of your mouth. It's a resin-based product that kind of flows in between. It's cured with a light, and I've seen it stay in the top of the teeth for 3 years. I've seen it stay in longer than 3 years. So it depends on what you're eating. If you're eating a lot of sticky things, obviously it will pop them out quicker. But if they don't, it's mainly to protect the teeth and prevent decay.
Yeah, it's mostly for children, you said?
Yeah, I've seen it done in adults, though.
Okay. What about x-rays? As an adult, I'm always kind of skittish about having x-rays done myself. But what about children? Is it safe because they're still growing? They
are safe. We are all digital imaging. The imaging is far less radiation than film. X-rays come a very long way. We definitely only expose if it's absolutely not necessary. We don't do it if it's not necessary. It's basically for diagnostic reasons, so that we can make sure that the patients don't have cavities in between the teeth that we're not seeing when we're in the mouth.
Is there like a frequency? Did you mention like a frequency as far as like how often it can be done, or is there no real limit on that type of thing?
It varies per case. If we have a consult child come in and there's suspicion that there's decay that we definitely can't see and we need a better look, we will definitely take an X-ray. It's recommended, once a year or once every 2 years, depending on the case, for sure.
So it always kind of it happens at the same time as like an annual checkup, or if there is a cavity, you might take more. Is that usually scenario?
Definitely. A panoramic X-ray is a developmental X-ray that they take for when children are obviously growing. So you'll see that once every 3 years, perhaps, maybe sooner, depending on if they're going to be requiring orthodontic work.
Okay. So What toothbrushes do you recommend that children use, and what are different types? Not necessarily brand, but what types of toothbrush do you recommend that children use?
Well, depending on the age, like I said, we use the tenders for the little babies. It's a finger type cloth that mom or dad can use. They wet it and they kind of just wipe out the baby's mouth. Right. And then we transition into, it's kind of like a curved where they can hold on to it, and it's rounded so they can get in, and just the end of it has a brush so they can get in there and brush the front of their teeth, because usually at a very young age they just have the front top teeth and the front bottom teeth. And then we transition to like an infant toddler brush, and not specifically any brand name, and then we go into youth and then adult for the older children. Okay,
is there any difference between a youth toothbrush, besides it being smaller, than an adult, or is it basically the same style or same?
It's a shorter brush. The head is compact. It's got less bristles. And then when they transition into an adult brush, it's going to have more bristles. The head is going to be a little bit bigger, and the handle will be a little bit longer.
Okay. You had mentioned fluoride before, and we had talked about some of the basically that it being in toothpaste and also some of the mouthwashes. What about the treatments that you do there at the office? Is there any guidelines around taking your child for those? Are they better, or should they only do those, or how do you see that?
There's different types of professional topical fluorides that are used. There's foams, there's gels. We personally use a varnish. It's a 5% sodium fluoride varnish that is brushed on the teeth at the end of the cleaning and exam. It's dispersed amongst all the teeth, and it lasts anywhere from 2 to 3 months or so.
Okay, all right. And at the end of that time, does the child come back for more, or is there?
No, we usually see them at the 6-month mark, unless it's a child that needs to come back sooner. We see them in 6 months, and we reapply. We'll do another fluoride treatment as well.
Okay. Something that happened to me personally when I was about 3 or 4, I think I fell and I chipped my tooth. I broke a tooth. So what happens when a child chips or breaks a tooth, either a primary tooth or a permanent tooth? How do you deal with that?
We recommend that they call the dentist as soon as possible. So, a lot of times the dentist will be on call. And if that's not the case, then obviously we'll get them in as soon as we can get them in to see them. A lot of times if you go to the emergency room, they won't be able to treat the way the dental office would be able to treat the child.
Okay. Do you usually just fill the tooth or cap it, or?
It really truly depends on the case.
Okay.
And how the break is.
Okay. And what about those silver amalgam type fillings that some of us still have, and are a little skittish about also? Do you use those, or what's the latest on those?
We don't personally use amalgam at the pediatric office. We use a resin-based composite filling. There are still offices that do use amalgam. It's not that it's a bad thing. It's still a durable material. I think it's just definitely doctor choice what they want to use as far as material goes.
Is there any wear differences, just out of curiosity? Are they both more or less the same?
I think they're very. I'm not certain, but I think that they do hold up.
Okay, pretty comparable. Okay. All right, well, that actually about wraps up where we wanted to cover in this segment. So I think we put out some good information on pediatric dentistry, and I want to thank Laurie for taking time out of her schedule for coming in and being with us today. And I want to thank you for watching. I hope you tune in next time for the next edition of Health and Wellness, and take care and have a really great day.